Hi, my name is Heather Sluder, and I'm a FNP student at the University of Memphis, and today's date is May the 30th, 2024, and I'm going to be doing a head-to-toe exam on my patient, Kaylee. I'm going to first start by scanning the room. Okay, now my exam will begin now. Throughout this exam, I will be inspecting the skin of the head, the face, the neck, the anterior, the posterior chest, the abdomen, as well as her extremities for color, texture, temperature, moisture, edema, turgor, bruises, lesions, and nevi, as well as scars. I will start by inspecting her head, ensuring that it is in midline position. I will then inspect the scalp, inspect and palpate the scalp for hair color, hair texture, hair distribution, as well as palpating for any tenderness, masses, lesions, depressions, or looking for any infestations. I will then palpate her temporal arteries for any tenderness. Next, I'm going to palpate her lymph nodes, starting with the preauricular, postauricular, occipital at the base of the skull, tonsillar, submandibular, submental, anterior cervical, and posterior cervical, as well as supraclavicular. Next, I'm going to palpate over her masseter muscle, looking for any TMJ, also looking for crepitus, tenderness, and subluxation. I will have her open, move side to side. All right, good. Now clench your jaws together. Okay, that's testing cranial nerve number 5, which is the trigeminal nerve, and that's the motor function. Next, I will test for the sensory function of cranial nerve number 5. So I'm going to have you close your eyes and tell me where I touch.
Forehead, cheek, nose, chin.
Okay, good. All right. Next, I will test cranial nerve number 7, which is the facial nerve, by looking at facial symmetry. I will have her smile, frown, raise your eyebrows, puff your cheeks, and pucker your lips. Okay, good. Okay. Next, I will move to her ears. I will inspect that they are, inspect the position and for symmetry as well. I will palpate the pinna as well as the tragus for any tenderness or masses. Next, I'm going to inspect the auditory canal as well as the tympanic membrane by pulling the pinna up and back. All right, auditory canal is patent and her tympanic membrane is a pearly gray. And same on this side, auditory canal is patent and the tympanic membrane is a pearly gray. Okay, next I will test cranial nerve number 8, which is the acoustic nerve. I will test for lateralization first by doing the Weber test. When I strike this, I'm going to place it on the top of your head. I need you to tell me if you hear in both sides or if you only hear in one.
Both.
Okay, good. Next, I will do the Rene test. This is testing for air conduction and bone conduction. I'm going to place this on the mastoid muscle behind the ear, and I need you to tell me when you can no longer hear it, and then I will move it to the front and tell me when you can no longer hear it.
Okay. Okay.
Okay.
Okay. Okay.
Okay, good. Air conduction is greater than bone conduction. All right, and lastly, I'm going to assess assess her hearing by doing a whisper test. I'm going to have you close or cover this ear, and I need you to tell me what I say.
1, 2, 3.
Okay, other side.
ABC.
Okay, good. Okay, next I'm going to move to her eyes. I will start by inspecting the brows, the eyelashes, the palpable fissures. I will also look at her sclera and her conjunctiva for color, discharge, or lesions. Next, I'm going to test cranial nerve number 2, which is the optic nerve, by doing gross visual acuity as well as peripheral vision as well. So first we'll start with the smelling chart. I'm going to have you cover one eye. What's the smallest line that you can read?
DHJBS.
Okay, other side.
DHJBS.
Okay, uncover both.
DHJBS.
Okay, good. Okay, now I'm going to test for her peripheral vision. I need you to tell me when you can see my fingers.
Okay. Okay.
Okay, perfect. Okay, next I will test cranial nerve number 3, which is ocular motor, by doing direct and consensual pupillary response. So just pick a spot on the wall behind me. Okay, good. Both are reactive to light. Next, I'm going to test for accommodation and convergence. So pick a spot on the wall. Now look at my finger. Okay, good. Okay, next I'm going to test cranial nerves 3, ocular motor 4, trochlear, and 6 abducens by doing the conjugate gauge with EOM. So just follow my finger with your eyes only. Okay, good. Okay, next I'm going to take a look at her internal eye structures using my ophthalmoscope. I'll first start by finding the red light reflex, following it in. Okay, optic disc margins are sharp and there's no evidence of AV nicking or wool spots. Same on this side. Okay, red light reflex is present. Optic disc margins are sharp, and there's no evidence of AV nicking or wool spots. All right, moving on to her nose. I will inspect, looking for any deformities and making sure that it is symmetric. And then I will test cranial nerve number 1, which is olfactory, as well as nasal patency. At the same time, I'm going to have you cover one nostril and close your eyes. And now tell me what you smell.
Alcohol.
Okay, the other side.
Cinnamon.
Perfect. Okay. Nasal is, your nose is patent, and then your cranial nerve 1 is intact. All right, next I will palpate for any tenderness in the frontal and the maxillary sinuses. And moving on to her neck, I will palpate to ensure that the trachea is in midline position. Now I'm going to palpate for her thyroid. I'm going to stand behind her. I will push to one side and have you swallow. Okay, good. Now this side. All right. Now I'm going to palpate the carotid artery. Okay, and I'm going to listen for bruits as well. Hold your breath. Okay. Perfect. Okay, no bruits were present. Now I'm going to inspect her mouth, looking at her lips, her teeth, her gums, the buccal mucosa, the palate, posterior pharynx, tonsils are a 1+. They are present underneath her tongue. Okay, good. Now I'm going to have you stick your tongue out and say ah. Okay, the uvula and soft palate rose upon phonation, and that's testing cranial nerves number 9 and 10, which is the glossopharyngeal and vagus. Now stick your tongue out, move side to side and up and down. Okay, tongue is midline without any fasciculations, and that's testing cranial nerve number 12, hypoglossal. Okay, now we're going to move on to her posterior chest. So if you could turn and face the window. I will start by inspecting, looking for any obvious deformities, also looking for any signs and symptoms of respiratory distress, such as nasal flaring, tachypnea, cyanosis, tripod positioning or retractions, or use of accessory muscles. I will test for symmetrical chest expansion. If you could take a deep breath. Okay, good. Now I'm going to test for tactile firmness. When you feel my hands, I need you to say 99.
99, 99, 99, 99, 99, 99.
Okay, good. Now I'm going to percuss in the intercostal spaces on her posterior chest. Okay, good. Now I'm going to do test for egophony. Whenever you feel my stethoscope, if you could say the letter E.
E, 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 E.
Okay, good. Now we're going to do bronchophony. Whenever you feel my stethoscope, if you could say 99.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay, good. And last, we're going to do whisper pectoriloquy. Whenever you feel my stethoscope, if you could say or whisper 1, 2, 3. Okay, good. Now I'm going to listen to her posterior lung fields. Getting those lateral lung fields as well. Okay, good. Now while I have her facing this way, I'm going to go ahead and test for CVA tenderness. I need you to tell me if this is tender at all. Okay. All right. Now if you could turn back around and face me. Looking at her anterior chest for the same signs of respiratory distress or any obvious deformities. I will start with the symmetrical chest expansion. If you could take a deep breath for me. Okay, perfect. All right, now whenever you feel my hands, I need you to say 99. This is testing for tactile firmness.
99, 99, 99, 99, 99, 99.
Okay, good. Now I'm going to listen to the lung fields as well. Okay, perfect. Okay, now I'm going to move on to her heart. I'm going to listen to her heart sounds using both the bell and the diaphragm of my stethoscope. We will start with the diaphragm. We have the aortic, which is in the second intercostal space, right sternal border. Pulmonic, second intercostal space, left sternal border. Herbs, third intercostal space, left sternal border, tricuspid, fourth intercostal space, left sternal border, and mitral, fifth intercostal space, mid-clavicular line. We'll do the same with the bell. We have aortic, pulmonic, herbs, tricuspid, and mitral. I will also palpate for PMI of the apical pulse. And then I would listen for a full minute. For the sake of this, we will say that she has a regular rate and rhythm of 70 beats per minute. Okay, now if I could have you lay down on your back for me. The head of the bed would be elevated 30 to 45 degrees, and this would also be looking for jugular vein distension. If you could turn your head to one side. Okay, and this side. Perfect. Okay, I don't see any evidence of any heaves or lifts. Then I will palpate for any thrills. The aortic, pulmonic, herbs, tricuspid, and mitral. Okay, I'm going to listen to those same areas again with both sides of my stethoscope. We have aortic, pulmonic, herbs, tricuspid, and mitral. Now the bell, aortic, pulmonic, herbs, tricuspid, and mitral. Okay, now we will move to her abdomen, looking at symmetry and contour of the abdomen. I will start by listening with the bell of my stethoscope to the listening for any bruise in the aorta, renal, iliac, and femoral. Okay. I'm going to listen to bowel sounds now with the diaphragm of my stethoscope in all four quadrants. We have the right upper quadrant, left upper quadrant, left lower, and right lower. Okay, now I'm going to percuss in all of those quadrants as well. Okay, good. All right, now I'm going to do some palpation, and then just tell me if there is any tenderness. Tickle? Sorry. Okay, now I'm going to palpate for her liver and take a deep breath. Okay. This is not, sorry, I cannot feel. And now we will do the spleen. Take a deep breath. Okay, good. The spleen is not palpable either. Okay, if I can have you sit back up and face me. Okay, we'll move on to the musculoskeletal system. I will start by inspecting her upper and lower extremities for overall skin integrity, any edema, any obvious deformities, looking for symmetry as well. And then I would palpate her joints of her shoulders, her elbows, her wrists, and her fingers, looking for crepitus, tenderness, redness, nodules, or deformities. I will palpate her radial pulses, which are 2+ bilaterally. And then I will also test for capillary refill, which is less than 3 seconds as well. Okay, next we are going to do the range of motion, starting with your fingers. Just follow along with me. We have flexion, extension, hyperextension, abduction, adduction, and thumb opposition. Okay, now for your wrist, we have flexion, extension, hyperextension, ulnar deviation, radial deviation, and rotation. All right, for your elbows, we have flexion, extension, hyperextension, and that's it. And then for your shoulders, we have flexion, extension, hyperextension, And then we have internal rotation, external rotation, and then swap. Okay, good. And then we have circumduction. Okay. Next, I will test or assess the strength of your fingers. Squeeze both. Okay, good. That's a 5 out of 5. Next, I'm going to have you pull against me, okay, and push. That is testing the strength of the tricep and the bicep, which is a 5 out of 5. Now we'll have you push against me and push. Okay, that's testing the strength of the shoulders, which is a 5 out of 5 bilaterally. And next I'm going to test for cranial nerve number 11, which is the spinal accessory nerve, by having her shrug against my resistance of her shoulders. Push up. Okay, perfect. That is intact. Okay, next we're going to test for cerebellar coordination by doing rapid alternating movements. We have hand flip-flop, okay, finger to finger rapid movements, and then finger to finger, touch my finger, touch my finger, touch my finger, touch my finger. Okay, perfect. Now we're going to test for graphesthesia and sterognosis. I'm going to have you close your eyes. We will start with graphesthesia. Just open your palms of your hands. I'm going to draw a letter on your palms, and you tell me what I'm drawing.
S.
Okay.
D.
Perfect. Okay, next we're going to do sterognosis. If you could open your palms of your hands again and tell me, I'm going to place an item in your hand and you can tell me what it is.
Battery.
Okay.
Marker.
Perfect. Okay. Next, I'm going to assess light touch sensation. Just close your eyes and tell me where I'm touching on your body.
Upper arm. Forearm. Thigh. Shin. Top of my foot. Inside the foot.
Okay, good. Next, we're going to test for the vibratory sensation. I will start by placing this on the ulnar prominence, and I need you to tell me if you can feel it.
Okay.
Other side.
Okay.
Okay. Now I'm going to do the medial malleolus, and tell me if you can feel this.
Okay.
Okay. Okay. Perfect. All right. Next, I'm going to test the deep tendon reflexes. We have the bicep, tricep, brachioradialis. There we go. Patellar. And then we have the Achilles. And then Babinski. Okay. Over here we have the tricep, bicep, brachioradialis. Okay. All right, now we're going to move to the lower extremities. I would start by assessing the and palpating the joints of the hips, the knees, the ankles, and the toes, looking for any deformities, nodules, crepitus, tenderness, redness, or edema. I will palpate for her pulses. We have posterior tibial and dorsalis pedis. Both of those are A2+ bilaterally. Okay, now we're going to do range of motion of your toes. So just do what I do with my hands, do with your toes. Flexion, extension, hyperextension, abduction, adduction. Okay. Now for your ankles, we have plantarflexion, dorsiflexion, inversion, eversion, and rotation. Okay, perfect. Now I'm going to have you push against me. That is plantar flexion, testing the strength, and then pull up. And that is dorsiflexion. Both are 5 out of 5. Pull against me and push. Okay, that's testing the strength of your knees. Both of those are 5 out of 5. Now if you could push in and out. Okay, good. That's testing the strength of your hips, and both are 5 out of 5 as well. All right, now if I could have you stand up, we're going to do range of motion of your knees and hips. Okay, so for your knee, we have flexion, extension, hyperextension, internal rotation, external rotation, and circumflexion. All right, flexion. I'm so sorry, that was your hip. Let's start over with your knee. We have flexion, extension, hyperextension. Okay, flexion, extension, hyperextension. Perfect. Now for your hip, we have flexion, extension, hyperextension, internal rotation, external rotation, and circumflexion. Okay, other side, flexion, extension, hyperextension, internal rotation, external rotation, and circumflexion. Perfect. Okay, next we're going to do the range of motion of your cervical spine. So we have flexion, extension, hyperextension, lateral flexion, and rotation. Okay, if you could turn to the side, and I'm going to have you bend over and touch your toes. By having her do this, this is lumbar flexion. Also, we are going to be looking at her spine, looking for the curvature of her spine, making sure there's no scoliosis or tenderness, making sure everything is in midline position. Okay, stand up. This is extension, and then lean backwards. Hyperextension, and then you have side to side, which is lateral flexion, and then turning, which is rotation. Okay, perfect. Next, I'm going to have you walk normal to the camera, just normally, looking at your gait. Okay, perfect. Now turn around, and I want you to walk heel to toe. This is checking your tandem gait. All right, perfect. Now turn around and close your eyes. This is the Romberg test. We are looking for any swaying. All right, now can I have you hop on one foot and the other? Okay, and this concludes our exam.